Hi.
Hi.
What have we got?
Hang on just a second. 55 is discharging and 53 is going to need a bottle. Okay, so that was what again?
Yeah, I can do that.
Okay. Okay. Okay, I got that.
Well, dear, I better go. You've had a long day and you need your rest.
Okay, thank you.
I will see you in the morning. All right, bye.
Hi. He's right, Holly. You need your rest. How you feeling?
Good, good.
Pain okay?
Mm-hmm.
All right. Well, I'll take Jacob back to the nursery for you, okay? Get him all settled in. Here we go. Sleep well, okay?
Thank you.
Good man, thank you. I'm John Rabin with the National Center for Missing and Exploited Children. What you just saw is something I deal with on a daily basis. Unfortunately, this isn't an isolated event. The abductor told Mother that she's a nurse. Mother felt safe in a hospital environment. She handed over her baby. In that instant, the mother's life is altered forever. And so is life on your unit. You may have the most advanced maternity unit in your region, the most advanced equipment, including electronics, the most highly skilled nursing staff. Still, that may not be enough to prevent an infant abduction. Parents have chosen you and your hospital to protect their new baby. Imagine how your unit would change after an infant abduction. Instead of delivering a new baby to his mother, you would be telling Mom, your baby is gone. Over the last 25 years, there have been 124 infants abducted from hospitals in the U.S. That's an average of 5 per year. May not seem like a big number, but think about how traumatic this event is. Most of these babies are recovered and reunited with families in a few days, some even within hours. But some are never found. No matter how long the baby is away, Parents are totally devastated. Serious psychological problems. Nightmares about the event. The devastation they feel changes their lives forever.
There was a woman who was dressed up as a nurse who came into my room who said my doctor was going to come and check on me. And she wanted me to get back in the bed. She put him back in the bassinet, was going to take him back to the nursery. She took the privacy curtain, pulled it all the way around my bed, so I didn't even have view of the bassinet. I had a call from the nursery. The instant it happened, they says, well, where's your son? And I said, well, he's supposedly been taken back to the nursery. And then for some reason the phone was dead. 3 nurses from the nursery came back and they took me into an isolated room. And that's when they told me what happened. I guess it's a fine line between sane and insane. And I guess before I kind of totally lost it, I stopped and said, okay, what can we do, or what are we going to do? And that's when they said that they were going to call the police. I guess I was in shock, but I guess it didn't really hit me what happened or what was happening until that next morning when I woke up and, you know, we were in a hospital and they're bringing in the bottles to feed the babies and all. And that's when I guess it really hit me that morning that I don't have a child. My child is gone. The woman who had abducted him called the vital records people to get a birth certificate. I guess she was going to try to go down and get food stamps or the WIC program for children. And the people at Vital Statistics were on alert. And it was the police who then went to her home, investigated. She had the child in her arms when they opened the door. As far as I'm concerned, this is a scar that's going to stay with us the rest of our life. I miss the little things. Him getting his first tooth. You know, him just maybe sitting up in the crib or whatever, just even looking at me. I missed a lot of those things that no one can give us back.
What motivates this person to abduct a baby? What's her profile? The behavioral assessment. 2 things. She's replacing a loss. Now, the loss could be due to failure to conceive, a stillbirth, a whole number of things. But to her, there's a key loss in her life. Sometimes only perceived. Lastly, she has a male significant other. That's important because he thinks she's pregnant. By him, she is birthing his baby in order to keep him from divorcing her or getting him to marry her. These women are childbearing age range, roughly 20 to 35. Now be careful, they are flyers. They're much younger and much older women who've done this. Usually no criminal record. If there is any record, it'll be probably as a juvenile for shoplift. She's emotionally immature. She clearly pre-plans this abduction. This is not she just walked in off the street and happened to snatch a baby. Some of her behavior is very impulsive. So while we know she plans and she's on your unit in order to take a baby, should a baby be in harm's way inadvertently, she will seize on that opportunity. Let's take another look at the abduction you watched a few minutes ago. Who is this person who's going to take our baby from the unit? Almost always a woman. She's probably been in the hospital before. Why? Because she lives in your community, normally 3 to 5 miles away from the birthing hospital. She's targeted your hospital, but not because it's a bad hospital or insecure. She targets it because she feels friendly toward it. I mean, all the kinds of things we want moms to feel about our hospitals, she uses against us. She's there, though, this time with the clear intent to take a baby. She'll find scrubs, lab coat, baby stethoscope, whatever, to make her look like a nurse to mom. She'll have ID, won't be hospital ID, where she works, where she has worked before, whatever. But it's enough that if mom's looking for ID but not looking for, is it the hospital ID and the proper symbol or color, then it helps her get away with what she's doing. She keeps parents from being suspicious by being who she is and acting the part. She will acquire mother's first name, sometimes the baby's name, from the chart, from status boards, from whiteboards, wherever. Key to acquire mother's first name, because she's going to go to mother's room, call mother by her first name on entry, talk to her about her baby, many times knows the baby's name also. She's very warm, she's friendly, she's just like what a caring nurse always wants to be.
pain, okay?
Mother feels comfortable.
Well,
So it allows the abductor the situation to take the baby, for a reason, back to the nursery for testing, for weighing, for whatever. What we now know is when she lifts that baby in her arms from the mother or sometimes from the nurse, that is the moment of birthing for her, vicarious birthing. Mother literally hands up her baby to the abductor. The abductor leaves mom's room, arm carrying the baby. Now we know no one should be arm carrying babies. Babies are always to be pushed in bassinets when they're outside of mother's room or the nursery. Mother either doesn't know that or doesn't remember it. The abductor heads immediately for the closest exit, usually a stairwell. Normally, there are only a few seconds between mother's room and the exit. Not a lot of time to notice something's going wrong. But if you know what to look for, you may be able to identify that an abduction is in progress and keep it from happening. The impact of the abduction is devastating to the parents, also devastating for the nursing staff of the maternity unit. Members of the nursing staff usually discover that the baby is missing and immediately initiate efforts to search for the missing newborn.